our appreciation for its bureau that led an efficient intergovernmental discussion, resulting in a substantive outcome. A special thanks also to the two co-chairs who led us towards a consensus-based decision. Southeast Asia Group support the decision to negotiate a WHO convention, agreement or other international instrument on pandemic prevention, preparedness and response with a view to adoption under Article 19 or under other provisions of the WHO Constitution as may be deemed appropriate by the intergovernmental negotiating body. Chair, Southeast Asia reiterates that equity is of critical importance for global health. The biggest lesson that we all have learned from the pandemic is that the glaring inequity needs to be addressed as a top priority. As mandated by the 74th World Health Assembly, the working group has very clearly pointed out the severe inadequacy of the IHR and has inter alia highlighted the benefits of and the need to develop a new legally binding international instrument to address the gaps exposed by COVID-19. We must keep equity at the core of our deliberations when we discuss the substantive elements, as well as when we draft and negotiate the zero draft of a new international instrument. Such an instrument with a view to adoption under Article 19 or under other provisions of the WHO Constitution, as may be deemed appropriate by the intergovernmental negotiating body, should inter alia address the following. It should help to address barriers to development and distribution of medical countermeasures, as well as related issues such as research and development, intellectual property, technology transfer, and scaling of local and regional manufacturing capacities during emergencies. It should contribute to strengthening the international legal framework for pandemic prevention, preparedness, and response, while recognizing the different levels of development and capacities across WHO member states. The group strongly believes that the public health infrastructure in developing countries needs to be strengthened significantly. Governments and development partners' effort should therefore focus on building and strengthening national and subnational capacities on preparedness and response. The group strongly feels that priority should also be given to establishment of strong regional capacities on R&D of essential medical products and innovation, for manufacturing, regulation, and procurement of tools, for equitable and effective access to essential medical products and innovations, and for clinical trials. Chair, lastly, the group would like to reiterate our region's strong commitment to take the process forward in building back better, including through developing an international instrument with a view to adoption under Article 19 or under other provisions of the WHO Constitution as may be deemed appropriate by the intergovernmental negotiating body, and to take all the essential steps to prevent a future pandemic, keeping in mind the principles of solidarity, inclusiveness, transparency, efficiency, and consensus, leaving no one behind. I thank you, Chair.
Thank you very much. I now invite Sao Tome and Principe to please take the floor, to be followed by Niger.
Sao Tome y Príncipe saluda al presidente, al director general.
Sao Tome and Principe would like to extend our welcome to the Director General, to the delegates, to the President. We are going to discuss the strengthening of preparedness and response to health emergencies at WHO, and we would like to congratulate the working group on strengthening the preparedness and response for their excellent report and recommendations. The COVID-19 pandemic has highlighted vulnerabilities of all countries and has shown that no one country can go it alone in mastering the capacity to mount up a comprehensive response. The Sao Tome and Principe is calling on the Assembly to set up an intergovernmental working group open to all members and all associated members with a view to developing and negotiating a legally binding instrument on the preparation and on the preparedness and response to pandemics. This pandemic has highlighted the inequalities among countries, the difference in the level of development for COVID countermeasures, and particularly the lack of capacity on the part of African states, small developing states, and our dependence on imports is very clear. We recognize the recommendations issued by various groups. The collaborative strategies are absolutely crucial to ensure an equitable access to vaccines and knowledge sharing, as well as the transfer of technologies. We need to step up our solidarity in order to put in place the IHR requirements and to develop a legally binding instrument which would incorporate a code of conduct for all actors, and the conduct of media during a pandemic. We also need sustainable financing to organize a proper response, but also to set up durable, sustainable, robust, sustainable health systems so that countries are in a position to react quickly to health emergencies. We support the One Health approach, an integrated response to health emergencies, which would also take into account the environmental dimension, animal health at local, national, and regional and global level. And we support the statement of the African region, which was delivered by Botswana. Thank you very much.
La parole, to be followed by Kazakhstan.
So I'll give the floor now to Niger, followed by Kazakhstan. Thank you. Niger.
Niger, c'est à vous.
Merci.
Many thanks. Thanks for giving me the floor. On behalf of the Minister of Health, of the Population and Social Affairs in my country, Madam President, I must first congratulate the Director General for his commitment given the sanitary crisis we all face, and will also thank him for the thrust behind the actions of the organization. Madam President, I would like to announce that Niger is in favor of a binding international instrument within the framework of the WHO that will deal with preparation and response to pandemics in line with the conclusions of the working group on strengthening preparation and response within the WHO to health emergency. This has the advantage of integrating the advantages and the constraints and taking stock of the difficulties and experience of different health systems around the world. So, my delegation is in favor of a proposal aiming for putting in place an intergovernmental process responsible for the negotiation and drafting of such an instrument. Indeed, global pandemic COVID-19 trends are far from having been addressed, given the continuing emergence of ever newer variants and their rapid expansion throughout the world. And the difference here from other pandemics we've seen so far are the social economic consequences of COVID-19, which are themselves difficult to master at the scale of humanity. In Niger, we've entered into our third wave, which unfortunately appears to be even more deadly than prior waves. Right at the time when we were hoping for some economic growth. In this context, given the double need to stop the pandemic and to prepare for other health emergencies in the future, our political commitment is strong. We think that the instrument that we're talking about should be aimed not only at the preparation, but also at the prevention and the control of infections, as well as the efficient addressing of cases as they come up. Well, better mutualization of efforts and strengthening of structures and international corporations on health. For my country, this framework would be appropriate to share its experiences and practices with other states and learn from those states' practices and experiences as well. The strengthening of the role of the WHO in the field of health and in dealing with the issues of financing health and access to knowledge and medical technologies are also important aspects that one should take into account to help the world in a more coherent and in a more coherent way so that it is more resilient and thus reduce the gap between the developed and the developing world in terms of the performance of their health systems. Vaccination is just one of the essential pillars of the fight against COVID-19. We do hope that this assembly will lead to conclusions that will allow us to help the world to improve its health systems, make them more resilient, and also come up with a prevention plan and a treatment plan. For my part, and for my country's part, under the direction of Bazoum Mohamed, the President of the Republic, head of the state, let me assure you of our determination to work with you, to work with all of the members of the international community, to make progress in a way to fight any pandemic that may come up.
Merci beaucoup, Niger.
Thank you, Najim.
Now we'll be glad to hear from Kazakhstan, to be followed by Japan. Kazakhstan, the floor is yours.
Thank you, Moderator, Director General, delegates of the special session. The issue of developing an international instrument by WHO for preparedness and response to the pandemic, which has been discussed in the session, is very important for the global health agenda. We support the report of the working group of member states on strengthening the WHO preparedness and response to health emergencies. Like other countries, we'd like to express hope that this report will become yet another important contribution to combating this global pandemic. We support the idea to set up an intergovernmental negotiating body to strengthen prevention mechanisms to ensure preparedness and response measures, which would become an open platform for the development and agreeing of a convention, agreement, or other international instrument. We express our readiness to take an active part in this discussion and in ensuring equitable access to countermeasures. We support the WHO strategy on combating COVID-19. Kazakhstan has already attained 40% of the population. The interpreter apologizes, but the speaker isn't clear. The sound is bad. Kazakhstan has developed its own vaccine against COVID, which meets all the requirements for manufacture, storage, and transport. So it is safe to be delivered to other countries. WHO has called us for global solidarity in combating COVID. So we have acceded to COVAX and recently delivered main doses of vaccine to Kyrgyzstan, and we are now in negotiations with other countries to supply them with vaccines. So Kazakhstan has made its own contribution. We are hopeful that by the end of 2021, WHO will attain its vaccination goal. Kazakhstan would like to extend its gratitude to the Director General, to Mr. Ghebreyesus, and calls on all countries for joint action in tackling these urgent objectives. Thank you very much.
Thank you very much, Kazakhstan. I now have the pleasure to invite Japan to please take the floor, to be followed by Equatorial Guinea. Japan, over to you.
Director General Dr. Tedros, honorable ministers, it has been nearly 2 years since the beginning of our global fight against COVID-19. We appreciate Dr. Tedros and the WHO for their dedication during this most difficult time. In order to live with this virus, Japan has implemented new lifestyles to achieve a peaceful balance between effective infection control and healthy function of society. After the 74th World Health Assembly, Japan was honored to hold the Paralympic Games Tokyo 2020 and the 72nd session of the Regional Committee for the Western Pacific. The Tokyo Games proved to be a symbol of global unity among people around the world, and our appreciation goes to WHO for its advice on effective infection control. At the Regional Committee, led by our Regional Director, Dr. Takeshi Kasai, member states of the Western Pacific discussed key actions required to tackle COVID-19 in the region. Dear colleagues and friends, Japan is confident that in the spirit of hope, solidarity, and determination, the world can share moments of joy and inspiration. In this special session of the World Health Assembly, member states united to take a leap forward for better global prevention, preparedness, and response against future health emergencies. During the 3 days, Japan will highlight the importance of achieving universal health coverage as a high-level principle in the new instrument. It is fundamental for stronger health systems and equitable access to medical countermeasures under the principle of no one left behind. Through international coordination and collaboration, Japan remains committed to the global discussion on the 2 urgent processes to better prevent, prepare, and respond to pandemics. Firstly, a new instrument. Secondly, strengthening the international health regulations, including through implementation, compliance, and targeted amendments. Japan will work further with WHO and other member states to rebuild the global health architecture led by a stronger WHO.
Thank you so much, Japan. I now invite Equatorial Guinea to please take the floor, to be followed by Iraq.
Muchas gracias.
Many thanks. Ladies and gentlemen, the current COVID pandemic continues to pose a challenge for health systems throughout the world. Given the systematic mutations of the virus, This makes it difficult to visualize the complexity. And this has led to sometimes a breakdown of health systems and unfortunately the death of many human beings. In the Republic of Equatorial Guinea, the behavior of the pandemic over time has seen 3 successive peaks or waves. Today, we've carried out 380 PCR tests. About 13,000 of them have been positive. The vaccination campaign is taking a positive turn. About 80,000 doses have been given out. Which is about 38.9% of the population. You will have noted that these indicators of our country shows that we are managing the pandemic well. And the governance of the national government is on top of the pandemic via the political committee in charge of the response of COVID-19, and especially with the leadership of the technical committee on surveillance and response of the pandemic. This battle, in order to win, means that we have to work all together against COVID-19. We have to strengthen our tools to fight against the pandemic in order to progressively go back to normal. And this is why that we agree with the proposal made to create a new international binding instruments. We are in favor of solidarity, which is an essential element so that populations are able to address the pandemic. Some people do not have access to a toolkit, and this is unjust. It's not in this situation that we'll be able to overcome the pandemic. Thank you.
I was just waiting for the interpreters to finish interpreting the statement. Thank you very much. And with that, we now invite Iraq to please take the floor, to be followed by Lesotho.
شكرا. بسم الله الرحمن الرحيم. السيد رئيس الجمعية، أصحاب المعالي والسعادة، السيدات والسادة.
It appears we had a
Director General, Madam Vice President, can you hear me now?
Yes, we can hear you and see you. Please proceed. Thank you so much.
Thank you. Thank you very much. I'll talk in Arabic. السيد المدير العام المحترم، أصحاب المعالي والسعادة.
Mr. Director General, Madam Vice President,
التأهب والاستجابة.
Apologies with the interpretation. The sound is probably not good, but we're going to do a check behind the scene and I will come back to you in a moment.
هل تسمعوني جيدا الآن؟ هل تسمعوني جيدا الآن؟
Can you hear me now?
I have thumbs up.
شكرا
Please.
جزيلا.
Thank you.
شكرا.
Many thanks. Many thanks and apologies for this small technical issue. So the first thing we have to do is to modify the IRH, the international health regulations, make some amendments, and these amendments should concentrate on strengthening national capacities and strengthening commitment behind the international health regulations. The amendments should cover in a way that they strengthen exchange of information and samples and data in an efficient and equitable manner. As such, the organization will have the most reliable and newest information. We also have to apply Decision 74A that was adopted at the last session of the WHA. Among these recommendations, all of them that has to deal with governments and reinforcing the expertise of the WHO strengthens the work of our organization and the capacities of each member country. We insist as well on the need to strengthen equity and to have more fairness, especially insofar as the means of diagnostic and vaccination are concerned. We also need to strengthen our ability to respond to health emergencies, thus our preparedness. Thus, we are in favor of the proposal put forward for the establishment of an intergovernmental body to negotiate an instrument or international treaty for health emergencies. This is something that will strengthen the role of the organization. This is also something that goes in hand with the amendments to the international health regulations. We should also strengthen financing, sustainable financing indeed, governance, and strengthen the role of the organization as the leader in this field. We have to work together, and we have to truly avoid any political bent. This is where we affirm our country's commitment. We truly believe that the WHO is a leader in the field of the coordination of global public health. Thank you.
I now invite Lesotho to please take the floor, to be followed by Uruguay. Lesotho, over to you.
Thank you, Madam Moderator. It seems that we are facing technical challenges from Capital to connect to the meeting. And as this, we are humbly asking for your indulgence and that of the Assembly to register our intervention as soon as we are able to solve the problem. And I believe that when we are ready, we will use the hand-raising function. I thank you.
Certainly understood and well noted, no problem at all. We'll proceed now with Uruguay, please, to be followed by Saudi Arabia. Uruguay, the floor is yours.
Señor Director General,
Mr. Director General. Ladies and gentlemen, it's for me an honor before such eminent participants at this special session of the WHA. It's for us an opportunity to take part in these meetings. This allows us to take part in precious discussions, which, without ado, will be beneficial for the global population. The period that we're going through is fraught with challenges. It's been 2 years now that we've seen transformations at the national and international levels that are unprecedented. This has put our health systems, made our health systems face new challenges and highlight the problems in our national capacities. Let me highlight the need to concentrate our efforts in the response to the issues raised by the COVID-19 pandemic. We've had to overcome several challenges, namely with regard to the production and distribution of vaccines, but also the availability of medicines, oxygens, and other things. And we've been able to do this thanks to international cooperation. Indeed, there are a lot of challenges that remain before the international health community, and thus we must continue to look for joint solutions. And more than ever, we have to think about the after, the post-pandemic. This is why we think that we need to strengthen the international health architecture and the leadership and the efficiency of the World Health Organization. For this reason, we think that the current debates that have been raised here within the organization are more than pertinent. These debates cover the international instruments that we have and look at the challenges and responses that we have now, in particular with regard to measures to avoid the international propagation of infectious diseases. This will allow us to protect our populations against the propagation of disease and to control it, and will also allow us to provide a response to a public health response that's proportional, taking into account at the same time of international health risks. We are available to work and to cooperate, to look for satisfactory solutions for everyone. These should include different points of views. We, above all, have to think about equity to reduce dissymmetries that we've seen within the framework of the current response to the pandemic. These inequalities are prejudicial to all of us. We believe that, given the lessons that we've learned from the pandemic, that we must look for solutions that take on board elements that have, up to date, have not been thought about or put in place within the framework of the international health regulations. We have to promote cooperation amongst states, the prevention, and the increase of national and international capacities. We have to as well show sufficient flexibility so that all members can adopt this instrument as part of their own toolkit. My delegation is at the disposal of the World Health Assembly to begin negotiations as quickly as possible. We can share our experience and our convictions. Today, we have the possibility to strengthen our cooperation. We are facing a unique moment, a moment when we can discuss international instruments, and we should be able to come up with a real response, not only to COVID-19, but also to any future health challenges that may come up in the future. Many thanks.
Thank you so much. I now invite Saudi Arabia to please take the floor.
Your Excellencies and distinguished colleagues, it gives me a great pleasure to participate in today's World Health Assembly's special session. I would like to start by thanking the WHO's Director General, Dr. Tedros, and the tremendous efforts put forth by the teams involved within WHO leading up to this important event. We all realize the importance of building resilient health systems, as well as the need for coordinated efforts and the support of global initiatives that aid all countries in overcoming this pandemic. This special session highlights the need for strengthening international mandate at highest level of leadership to ensure that we are better prepared for future outbreaks as they are imminent. Early detection, reporting, and notification of all public health events is key in proactively responding to any outbreak. This has been integral, especially during the Kingdom's experience in tackling MERS-CoV. We strongly support IHR and stress on the importance of strengthening its mandate through implementation, compliance, and support of its core capacities. In order to reduce risks posed by emerging disease of zoonotic origin, we emphasize the need for a holistic view using One Health approach by all nations, which was also an important area of focus during the Italian presidency of the G20 this year. The Kingdom has been proactive in global efforts of reaching low to middle income countries and has contributed over $833 million through direct support and through instrumental initiatives such as the ACT Accelerator and the COVAX facility, as no one is safe unless all are safe from this pandemic.
We thank Saudi Arabia and now invite Timor Leste to take the floor, to be followed by Sri Lanka. Timor Leste, over to you.
Chairperson, Director General Dr. Tedros, Excellencies, Honorable Delegates, ladies and gentlemen. Timor-Leste delegation present compliment from the government and people of Timor-Leste to the special session of 74th World Health Assembly to consider developing a WHO convention, agreement, or other international instrument on pandemic preparedness and response. Timor-Leste appreciated the leadership role of WHO Secretariat in fighting against the COVID-19 pandemic globally at the country level and the effort in organizing the special session of WHO toward a legal binding instrument for pandemic preparedness and response for the future. The International Health Regulation, IHR 2005, is a powerful instrument for preventing, detecting, and containing the spread of communicable disease across the border. It plays a positive role in fighting against the COVID-19 pandemic. However, there are obvious gaps and limitations as we can see. Member States and WHO Secretariat need to develop a treaty or instrument that will be able to deal with border issue of pandemic preparedness and response. First of all, this instrument must be able to unite all member states under umbrella of solidarity and equity. The COVID-19 tells us countries should help and share each other if we don't want to fail ourselves. Indeed, Timor-Leste cannot survive this flood without the support from the international community. Secondly, this instrument should strengthen coordination at global, regional, and country level, collaboration and cooperation among different sectors using the One Health approach. Thirdly, a resilient health system is the center of pandemic preparedness and response. We need to build up and enhance our health workforce, infrastructure, and ensure capacity of the health system. Particularly, Timor-Leste welcome the initiative to develop a treaty for pandemic preparedness and response and look forward to participating actively in negotiating of the treaty. Last but not the least, we recognize the central and leading role of WHO in global health. Member state and international community should provide adequate and sustainable financing to organizing and to ensure its. I thank you.
And I thank you in return. And now we invite Sri Lanka to please take the floor, to be followed by the Republic of Moldova. Sri Lanka, the floor is yours.
Honorable President, distinguished excellencies, distinguished delegates, we extend our gratitude to the WHO for initiating a timely and much needed discussion on further strengthening the global preparedness and response activities for disasters, including pandemics in the future. I fully endorse the ROV read by Indian colleague on behalf of the Southeast Asia at this moment. Sri Lanka also acknowledge and appreciate the effort and the hard work put by the co-chairs, the bureaus, and the representative of the member states in the member state working group on strengthening WHO preparedness and response to the health emergencies over the last months. COVID-19 pandemic is a protracted disaster that has led to a global economic crisis to which the lower and the middle income countries, including Sri Lanka, have suffered. Therefore, the magnitude of a disaster created by COVID-19 pandemic by far and large has made us reflect on the overall support extended to the member state for its response. It is understood that the current pandemic affected almost all the countries at the same time, resulting in a high demand for the requirement of hospital facilities, medical equipment, treatment, and testing facilities and vaccines, despite the public health and social measures that were implemented within the countries. The picture in Sri Lanka is also the same. However, this increased demand due to the pandemic had to be addressed over the extended period, compromising our economy, following which the livelihoods of our people were adversely impacted. We extend our gratitude to the WHO for taking measures to provide equitable access to COVID-19 logistic treatments and vaccines. Although many countries, including Sri Lanka, had hoped for improved equitable access to these commodities through COVAX facility, however, this objective was not fulfilled as expected due to several challenges. Thus, as we have already voiced during the working group meetings, it is important to address the issues of equity in distribution of supplies via a better organized and coordinated mechanism within the UN system during the future disasters. In addition, we would like to emphasize the importance of timely knowledge and technology sharing in the context of preparedness and response to disasters, including pandemics in the future. This will minimize digital divide, which may future contribute to adverse health, education, and social outcomes of the country. Also, it is important to further strengthen the health system, including infrastructure and human resources, so that they are effectively prepared and are resilient to disasters. A special emphasis should be given to address the systemic effects following the disaster, especially the impact on strengthening primary health care and provision of universal health coverage, which in fact were adversely affected during the current pandemic. International health regulation is currently legally binding instruments to address the preparedness of public health emergencies of international concerns. However, there is room for further improvement. Sri Lanka, therefore, wishes to reiterate and re-emphasize that we wish to support the WHO in any future endeavors that would address our aforementioned concerns, which would improve the globally to combat future disasters, including the pandemics, better. Thank you.
Thank you so much. And now I give the floor to the Republic of Moldova, to be followed by Montenegro. Republic of Moldova, the floor is yours.
Director General, distinguished delegates, ladies and gentlemen. The COVID-19 pandemic has opened the fault lines in our health systems and continue to be a stress test for public health services that were already overwhelmed even before the pandemic. We have a population of 3.4 million. Moldova has had more than 360,000 COVID-19 cases and more than 9,000 deaths. Despite the fact that the evolution of the pandemic in different regions visibly differ, our success in this battle is mutually dependent on the joint response. No one nation can be safe unless all nations are safe. Among important lessons to draw from these experiences in the need for true cross-sector and cross-country collaboration to build resilience in preventing future outbreaks and defeating them effectively when they do happen. From a country perspective, I would like to highlight three major areas we expect an international treaty on pandemic preparedness to bring significant improvements. First, better surveillance of pandemic risks and better alerts. The emergence of the Omicron variant underlines need for high-performing system for surveillance of outbreaks of new pathogens. International cooperation is crucial for global health security. Today, Moldova has the equipment purchased by the European Union with the support of WHO for the sequencing of the virus, and in 2 weeks, we will be able to perform them in the country that opens a new stage in virus control. Second, better response. An international treaty on pandemics would enable countries to strengthen their ability in responding effectively and do even in a timely manner. Similar to other countries, Moldova is an eligible COVAX facility country and benefit free of charge from doses of vaccines against COVID-19. We have another significant support coming through dose sharing. In addition, the government of the Republic of Moldova has secured enough funds for the procurement of the needed doses to protect the population. Moldova has ensured extensive access to COVID-19 vaccines, providing 7 types of vaccines available to our population. As today, more than 1.6 million doses of vaccine against COVID-19 were administered. Despite the wide availability of vaccines, over the 9 months of the immunization campaign, Moldova has reached the vaccination coverage for the general population of only 27%. It is unfortunate that COVID-19 and the avalanche of misinformation accompanying the pandemic led of a decrease on confidence in vaccines. And here we come to the third area in international treaty would improve better communication and tackling misinformation. Dear colleagues, being extremely grateful to all the support provided by the international community to the Republic of Moldova in the context of COVID-19 pandemic, we also feel honored to be able providing help to neighboring countries when a team of medical doctors and nurses from Moldova intervened in the humanitarian aid mission. In conclusion, the Republic of Moldova commends the WHO intention in establishing an intergovernmental negotiating body on pandemic international treaty to foster leadership and solidarity across countries to defeat COVID-19 and provide international coordinated response. Thank you very much for your attention.
Thank you very much. And now I'll invite Montenegro to please take the floor. Montenegro, can you hear us? We cannot hear you here in the room. Yes, perfect. Please proceed.
Okay. Do you hear me now?
Yes.
Madam Chairperson, Director General, Excellencies, dear colleagues, I have the honor and privilege to address the special session of the World Health Assembly. We view this session as unique, historical, and a milestone in many respects. This requires the urgency of the situation, calling on all of us to make bold decisions and act decisively to close the gaps and deficiencies that still make us extremely vulnerable to highly transmissible variants of virus that continue to evolve rapidly. Montenegro aligned with the EU statement. As a member of the Group of Friends of the Treaty on Pandemic Preparedness and Response, Montenegro also aligned with the joint statement, and let me therefore highlight some of the pertinent points. We greatly welcome the consensus reached for the adoption of the draft landmark decision to strengthen pandemic prevention, preparedness, and response. In doing so, we have shown our commitment to move forward together with an increased sense of urgency, solidarity, cooperation, and common purpose for the benefit of the whole international community. This is vigorously solidified by the fact that the vast majority of member states have co-sponsors the decision, including Montenegro. Montenegro shares views that a new legal instrument under Article 19 of WHO Constitution has the potential to best address the blatant inequities in pandemic response and the shortcomings of the current legal framework. Also, several key aspects of health emergency preparedness and response, such as early development and equitable access to and distribution of pandemic countermeasures, data, and sample sharing, a One Health approach, to name a few. Madam Chair, almost 2 years have passed, and the end of the COVID-19 pandemic is not in sight. Conversely, infection rates are on the rise, and the new variants presents a continuous and growing risk. The widely embraced paradigm known as safe until everyone is safe has not yet been translated into action. The COVID-19 crisis has swept across the globe without sparing anyone. Still, different societies are affected to varying degrees. The most vulnerable are hit the hardest. All this solidifies the need for a comprehensive and coherent approach to strengthen the global health architecture with adequately equipped, empowered, and sustainably funded WHO at the center. On this note, we echo the call to seize this opportunity to advance the multilateral commitment towards building a system that provides for a rapid, joint, effective, and equitable global response to future health crises with pandemic potential. I thank you.
Thank you very much, Montenegro. Madam Vice President, I understand that you would like to take the floor.
Thank you, Secretariat. Dear delegates, as the second session started later today, I would like to propose that we continue today until 5:30. Furthermore, as delegates may recall, it was agreed in the beginning of the meeting that we would provide the opportunity for observers, United Nations organizations, and other intergovernmental organizations to take the floor. I would like to propose that we turn to these statements at 5 o'clock. Are there any objections to proceed in this way? I see no objections. Thank you. Thank you, Secretariat. You have the floor again.
Thank you very much, Madam Vice President. We now proceed with the statements, and I invite Nepal to please take the floor, to be followed by Andorra. Nepal, the floor is yours.
Thank you, Moderator. Honorable Chair, Director General of the WHO, Excellencies, distinguished delegates, Namaskar. On behalf of the Government of Nepal, I would like to express my sincere thanks to the Director General of the WHO for his dynamic leadership to this organization during such a tough time, while also ensuring all other global health services on track. Allow me to express my deepest condolences to all the lives we have lost to the deadliest pandemic. I take this opportunity to recognize selfless efforts of frontline health workers, health professionals, and support personnel for their relentless work to save lives amid this humanitarian crisis of the century. My sincere thanks also goes to the scientific community and institution for their tireless effort in developing many life-saving measures and devices to ensure better services for people and continue their socio-economic activities. Excellencies, while many countries are working on improving their legal and administrative measures at the national and subnational levels, we also realize that more robust legal frameworks at the global and regional levels would help us better respond to public health emergencies and save lives. During this pandemic response, we learned that the current international health regulation provisions have numerous gaps. These insights must help us in responding to future emergencies. We need a better prepared world and health systems with better legal and policy frameworks along with better tools and technologies. We must expand our health coverage and access while also protecting our citizens from financial risk. Avoid being derailed from our path towards universal health coverage at a time when the coronavirus is continuously mutating. This necessitates strong political commitment, increased strategic investment in the health sector, and prudent resource allocation. We have also realized that equitable access to new tools and technologies, including diagnostics, vaccines, drugs, and other life-saving measures, is essential. The current IHR does not address this important issue of equity. Excellencies, Nepal firmly believes that global legal and policy frameworks are vital to promoting collective responses to public health emergencies, fairer access to the tools and technologies, and data sharing and transparency. Nepal supports the proposal to develop a pandemic treaty or convention. We think that the Global Framework Convention will provide us with a framework, strategies, and approaches for addressing future pandemics. However, the IHR and subsequent protocols can provide greater guidance on how to put such arrangements into action. Nepal recommends that such a treaty or convention focus on a measure to prevent pandemics that are not covered by IHR. Likewise, it should also provide clear guiding principles and frameworks for pandemic preparedness and response effort by integrating health systems, strengthening effort to make them more resilient for future emergencies. The framework should also ensure fairer and equitable access to tools and technologies, as well as promote multi-sectoral collaboration for better measures and mechanisms under one health approach. I wish to conclude, Excellencies, by assuring Nepal's constructive contribution in this deliberation. Thank you.
Thank you very much, Nepal. I now invite Andorra, please, to take the floor, to be followed by Malaysia. Andorra, the floor is yours.
Monsieur le Directeur.
Director General, Your Excellencies, ladies and gentlemen, this is a great honor to speak on behalf of the government of Andorra in order to share with you our hopes, our aspirations and our concern. This pandemic has highlighted our vulnerability in our capacity as individuals, nations and organizations, but it has also taught us numerous lessons that in working together we will be able to overcome this crisis and come out better and stronger. The vulnerabilities are at all levels. The pandemic has also given rise to a wide solidarity campaign to secure assistance and resources. During the 74th World Health Assembly, a working group was set up on the strengthening and the preparedness and response to health emergencies with the revision of the international health regulations and the drawing up of a new document. This group has concluded that the current situation is unacceptable for all and that we should work along the following two axes. First of all, to review the IHR and secondly, to achieve a consensus on this new instrument. We believe that we should focus on the aspects of response to preparedness and response to pandemics not covered by the RHA, which has been stressed by Gavi. This is the right forum to develop efficient mechanisms in order to combat future pandemics. Andorra is in favor of equity in access to vaccines, PPE and diagnostic tests. If this crisis has taught us anything, is that nobody is safe until everyone is safe, and that we cannot afford to leave anybody behind, large or small, rich or poor. The vaccination should help us to arrest the further spread of the pandemic through international cooperation, both multilateral and bilateral. Andorra is a small country taking part in the initiative of small states of the European region of the WHO, the special nature which needs to be taken into account when revising the IHR and developing a new instrument. Your Excellencies, we hope that we have a consensus and the broadest possible support with the One Health approach so that everybody attains the highest possible level of health. Permit me once again to reiterate our firm commitment to solidarity and multilateralism for a better future for the future generations. We hope that this special assembly is a success. Thank you, and I also thank you.
Please take the floor to be followed by Romania. Malaysia, over to you.
The Honorable Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, distinguished delegations from member states and observers, ladies and gentlemen. It gives me great pleasure to extend our warmest greetings from Malaysia to this second special session of the World Health Assembly. Our discussion today will hopefully lead to an improved approach to pandemic preparedness and response based on lessons learned battling COVID-19. The experience over the past year and a half has shown us that the SARS-CoV-2 virus remains a clear and present threat to everyone around the globe so long as it continues to spread. This is evident with the emergence of a new heavily mutated variant detected and reported swiftly by South Africa. We know Omicron is probably more transmissible than Delta, but it is also still not clear whether Omicron causes more severe disease compared to infections from other variants. Battered by repeated lockdowns, governments are reluctant to impose harsh restrictions for a variant we still do not know enough about. The discovery of Omicron and what appears once again to be an uncoordinated global response underlines the urgent need for strengthening global preparedness and response to health emergencies. This special session is very timely as we must not wait any longer to come up with a solution. Malaysia supports the call by the WHO Director General for an international agreement on pandemic response. But this agreement must not just be inclusive and accountable, it must also be equitable and transparent, especially when we have the tools to fight the pandemic, but they have not been distributed equitably. Malaysia is of the view that the proposed two-track approach, that is the targeted amendment of the international health regulations and the development of a potential WHO instrument and modalities of its negotiations, will promote the strengthening of health systems and the international preparedness for and response to future pandemics. While Malaysia acknowledges that the amendment of the international health regulations may lead to a complex and lengthy process, there should be a concerted effort to clarify the true legal and obligatory nature of the IHR. The compliance mechanisms under the IHR and the WHO Constitution should also be strengthened. We take note that there are at least 3 categories of new instruments under the WHO Constitution: a convention under Article 19, regulations under Article 21, and recommendations under Article 23. While these options are available, it is important for us to study the comparative benefits and risks of choosing one option over the other. Only by doing so can an informed decision be made as to the selection of any one of the instruments over the other. Malaysia values the IHR as a key component of the global health architecture and is convinced that a new international instrument can complement and strengthen the IHR. Ultimately, Malaysia is a strong advocate for equity and access in the true spirit of universal health coverage and leaving no one behind. It is our aspiration that this special session's outcome will strengthen our preparedness for future threats and emergencies. As Dr. Tedros mentioned in his opening remarks, we should make the world a healthier, safer, and fairer place for our future generations. On that note, Malaysia thanks you.
Thank you very much, Malaysia. We now invite Romania to please take the floor, to be followed by Sudan. Romania, the floor is yours.
Honorable President, Director General, distinguished guests, Excellencies, ladies and gentlemen, Romania fully aligned itself with the European Union statement delivered by Slovenia. We thank the WHO and the Working Group on strengthening WHO preparedness and response to health emergencies for their work in drafting the report. In particular, we express our gratitude for the work of the Bureau of this working group, for its competent leadership in building a common approach. We are strongly committed to strengthening the global health governance, having WHO as its center. To strengthen our global health architecture, we need good instruments. For this purpose, we support the development of a legally binding instrument in the field of pandemic prevention, preparedness and response that will strengthen the WHO capacity to detect, assess and respond to future pandemics. The most effective way to ensure that future pandemics are better managed is strengthening the authority and independence of WHO and the use of binding international agreements. The COVID-19 pandemic must be the impulse for the international community to take the necessary steps in order to secure collective interests across the spectrum of pandemic preparedness and response, from preparedness capacity building to early warnings and follow-up obligation and fair access to response measurements. The experience that we have lived through the past 2 years have shown us that countries all over the world must identify common mechanisms to respond to health emergencies so that the world's citizens can receive the necessary treatment even in extreme situations. We are committed to engage in further debates on ways and means to strengthen WHO on a coherent and constructive manner. We also believe that only our collective actions at the global level will allow us, all member states of the United Nations, to combat the current and future pandemics. Thank you for your attention.
Thank you so much, Romania. Now over to Sudan, please, to be followed by the Islamic Republic of Iran. Sudan, the floor is yours.
Thank you, Chair. Sudan aligns itself with the statement presented by Iraq on behalf of the East Mediterranean region. Sudan notes with appreciation the work of Member States Working Group on strengthening WHO preparedness and response to health emergencies and the World Health Assembly's decision WHA 74/16 emergencies to hold a special session to consider developing a WHO convention, agreement, or other international instrument on pandemic preparedness and response. The government of Sudan believes that such an instrument can be complementary to and even strengthen the international health regulations and can also bridge the gap between various existing international agreements that other tools may not be able to. Sudan agrees that this tool can play a major role in ensuring member states' adherence to global preparedness and response plans, and even provide a unified framework and guidelines that can be applied on national, regional, and international levels. These guidelines will even help harmonize and unify efforts between nations, as well as help nations bring not only the health sector, but various sectors like transport, trade, and finance under one umbrella with one framework that has divided responsibilities and tasks to maximize the effectiveness of plans. In the Sudanese context and on the national level, the Ministry of Health has championed and led all efforts to fight the pandemic, attempting to coordinate with all governmental and non-governmental sectors. Despite all these great efforts, Sudan is still drastically affected by the pandemic, and its fragile health system is barely able to keep up with new and critically ill patients. However, having clear guidelines on preparedness and response would provide a better overall outcome, as well as better coordinated response on a regional and international level. Chair, a legally binding agreement would provide the clear governance frameworks. In addition to that, it would make great use of the momentum the health sector has gained under the current pandemic and ensure better commitment to better preparedness and response to future pandemics, given that there is a great disparity between perceived preparedness and actual preparedness. A treaty will also ensure that there is equitable access to countermeasures, as well as a means of ensuring more just distribution of these countermeasures. The situation today shows a clear unevenness in distribution of said countermeasures, especially vaccines, which has hindered a lot of low middle income countries' ability to properly respond to and actively fight the pandemic. The treaty could also allow for better long-term solutions, like increasing local production of vaccines, which will contribute greatly in fighting all the emerging variants of SARS-CoV-19, as well as prepare the infrastructure in case of any future pandemic for rapid local production of vaccines or drugs that may be needed. Sudan agrees that while there is a need to review and update the international health regulations to guarantee better action and reaction in the future, this alone may not be enough to produce the desired level of commitment to the international health regulations or the needed level of global health system resilience. In conclusion, Sudan calls on the WHO and all member states to consider this proposal, keeping in mind that all victims of the current pandemic in low middle income countries and those still suffering, either directly or indirectly, from the fallout of this pandemic, in hopes of coming up with a more future-proof solution. In the event of a decision being made on adopting a treaty as a way forward, Sudan also urges an inclusive approach in the drafting of the treaty and recommendations made by low middle income countries to be taken into consideration, as they have suffered the greatest from the current pandemic. I thank you.
I thank Sudan and give the floor to the Islamic Republic of Iran, to be followed by India.
Honorable Ministers, Director General of WHO, Excellencies, ladies and gentlemen. It's indeed a pleasure to address this august body at this critical juncture when the global health community has gathered to evaluate its efforts in identifying the best way forward to strengthen preparedness and response capacities for health emergencies in the future. Over the past 2 years, COVID-19 pandemic has caused a great deal of catastrophic ailment and suffering for all people in the world, and the challenge still continues. The lesson learned from the enormous challenge posed by the recent pandemic is that the world cannot afford to remain idle until the next deadly pandemic strikes. We need to be prepared better and respond more efficiently and effectively in the face of future pandemics. Madam President, Iran strongly supports the fundamental role of WHO in global health security and emergency response initiatives, and believes that there is an urgent need to strengthen the organization in order to fulfill its constitutional mandate, including initiatives to consolidate its efforts vis-à-vis the future global health challenges. We reiterate our position that the IHR remains an essential existing tool in addressing global health emergencies. However, the IHR efficiency hinges over member states' capacity and commitment to its implementation. Multilateral cooperation to support IHR implementation, in particular through predictable and sustainable financial support at the national, regional, and global levels, is highly important. We further underline that the relationship between any new legal framework and the existing international IHR would need to be clearly articulated and defined. In our view, any new instrument should complement and not overlap or substitute the IHR. We are cognizant of different views and reflections that seek to unify member states towards a common global agenda for more resilient societies to further pandemics. In this regard, we stress the equal access to medical countermeasures and manufacturing capacities remains paramount for developing countries that sustain the disproportionate consequences of the COVID-19 pandemic. The current pandemic continues to show the challenges posed by the lack of access to COVID-19 tools and vaccines. This concern must be addressed in any foreseeable outcome of our collective endeavors. Finally, one of the most important considerations in developing a pandemic treaty is how to ensure a fair supply of medical countermeasures to all member states and a streamlined technology transfer to those developing countries which can potentially serve this bill. Therefore, the best decision should be made by focusing on this goal. A clear, consensus-based path forward towards our shared goal is what we should expect from this whole process. My delegation remains steadfast to engage constructively in the special session's deliberations. Thank you for your attention.
Thank you very much. I now invite India to please take the floor, to be followed by Haiti. India, over to you.
Madam Chair, Director General Dr. Tedros, Excellencies and delegates, good afternoon to you all. Chair, I thank you for giving me the floor. India welcomes the report of the working group on strengthening WHO's preparedness and response to health emergencies and places on record our appreciation for the work of the Bureau. COVID-19 pandemic continues to pose a grave threat to global health and economy. We therefore urge the working group to continue its deliberations aimed at implementation of other key recommendations made by the three mechanisms, including amendments to international health regulations. India welcomes the consensus reached on the draft resolution containing the decision to establish an intergovernmental negotiating body and looks forward to working together with member states in order to achieve its goals. The next task before us is to carefully delineate draft elements of the future instrument, taking into account various proposals made by member states. We should prepare an exhaustive compilation of various elements proposed by member states, which would provide the negotiators a basis to build consensus. In doing so, we should also take into account the final report of the working group. India assures of its constructive engagement in preparation of the elements and during the negotiation of the instrument. India believes that equity is of critical importance for global health, and we must keep equity at the core of the new instrument. We should also address the barriers to development and distribution of medical countermeasures, including aspects related to intellectual property, technology transfer, and scaling up of local and regional manufacturing capacities during emergencies. India believes that public health infrastructure in developing countries is underdeveloped and requires international support. Our efforts should therefore focus on provision of technical and financial support for building capacities of the member states. We also believe that the future instrument should include elements for prevention and management of zoonotic risks as part of One Health approach. It should strengthen international legal framework for pandemic prevention, preparedness, and response. While engaging in deliberations and negotiations for a new instrument for preventing a future pandemic, we should continue to accord a high priority to implementation of other key recommendations, including WHO reforms. In this regard, we highly commend the initiatives taken by the WHO under leadership of Dr. Tedros towards implementing some of the key recommendations made by various panels. To conclude, I would like to reiterate India's strong commitment to the welfare of the entire humanity, which is reflected in our continued contribution to the global action against COVID pandemic through supply of medical countermeasures and vaccines to over 150 countries. We have also made available our CoWIN platform for smooth organization of vaccination to other countries. I thank you, Madam Chair.
Thank you very much, India. We now invite Haiti, please, to take the floor, to be followed by Slovakia. Haiti, the floor is yours.
Mr. President, Director General, Your Excellencies, the Ministers, ladies and gentlemen. On behalf of His Excellency, the Prime Minister, Dr. Ariel Henry, and on behalf of the Haitian delegation, I'd like to extend my congratulations to you and my wishes of success in the conduct of this special session to examine the benefits of developing a convention, an agreement, or another international instrument on the preparedness and response to pandemics. I'd like to welcome all of the delegations here present. Just like in 2010, when I was a ministry official having to deal with the cholera epidemic on top of a devastating earthquake, I'm reliving that moment because right now we have COVID-19 on top of the consequences of the another devastating earthquake on the 14th of August last year in the south of the country. That's why, well, this just goes to show to what extent the topic under discussion is close to the heart of the health professionals in my country. We have learned lessons from various epidemics and natural catastrophes, and so Haiti is fully seized of the need to strengthen the World Health system and to develop a universal, harmonized, rational, and adapted approach to health emergencies. The COVID-19 pandemic has highlighted the need to build up resilient national health systems rooted in solidarity. Haiti welcomes the conclusions of the working group of member states on the strengthening of the preparedness and response to pandemics. with a view to enabling universal and equitable access to vaccines, medicines, and diagnostics for the benefit of future generations. Mr. President, together, we need to be better in preventing pandemics, in detecting them, in evaluating them, and reacting efficiently and in a coordinated manner. The COVID-19 pandemic has brought into brutal relief the pain of the world and the fact that no one is safe until everyone is safe, which reminds us that the population of Taiwan is not represented during these discussions, which we regret. Slovakia.
Distinguished Director General, honorable ministers, ladies and gentlemen, Slovakia aligns itself with the statement of the European Union and its member states, being aware of the high value of consensus in these exposed times. Concerning the current health crisis, I am convinced that there is no single person who would put in doubt that an urgent and transformational action is needed. This crisis has been anchored by geopolitical divides, inequities, and fragmentation, and precisely at this session, we are strongly mandated to do the meaningful engagement in identifying multilateral solution. This solution should secure a vigorous mechanism for tackling the concurrent and future health emergencies while reducing the possibility of perpetuating existing divisions at global level. Slovakia perceives the urgency to adhere to comprehensive and legally binding instrument which would secure the state's mobilization at the highest level, as well as it would also enhance the potential for greater sustained attention and compliance. In parallel, however, such process requires targeted reassessment of the international health regulations, given that it is a crucial component of the global health architecture. Moreover, it became obvious that under the current pandemic preconditions, the international health regulations are missing the correspondent agility. Besides supporting the member states-driven process, Slovakia widely promotes the inclusive science and evidence-based approaches, which should continue to represent a major stepping stone when tailoring the countermeasures and adjusting further steps. In addition, the science-based approaches and coordinated actions are also inevitable when tackling misinformation and stigmatization, which severely undermine the public health. In the very end of my intervention, I wish to stress that Slovakia supports the WHO leading role in global health governance. At the same time, I am persuaded that the determinants of successful advancement are the coherence, complementarity of processes, as well as following up on the WHO reform. Slovakia is ready to further contribute to its development and advocate for fair, equitable, and inclusive actions through the global health spectrum.
Thank you, Slovakia. I now invite Switzerland on behalf of the European region to please take the floor, to be followed by Cambodia.
Mr. Chair, Director General, Switzerland has the honor to read out this statement on behalf of the WHO European region. We thank the co-chairs of the Working Group on Strengthening WHO Preparedness and Response to Health Emergencies, Her Excellency Mr. Grata Enda Vedandias of Indonesia, and Mr. Colin McGafe of the United States of America, as well as the vice chairs and members of the Bureau in their capacity as representatives of their respective WHO regions. Dr. Malebogo Kebabione of Botswana, His Excellency Monsieur François Rivasso of France, Dr. Ala Alwan of Iraq, and Dr. Lynn James of Singapore for their tireless work over the last 6 months. We would also like to acknowledge the enormous effort of all member states who have been actively involved in the sessions of the working group, and recognize the work of the co-chairs of the drafting group, Chile and Australia, and their important contribution to the result of the draft decision we have in front of us today. The member states of the European region support the draft decision in document SSA2/COM/1, revision 1, the World Together establishment of an intergovernmental negotiating body to strengthen pandemic prevention, preparedness, and response. The consensus reached on the process ahead is an important step towards globally strengthening prevention, preparedness, and response for health emergencies. As a region, we are committed to constructively engage in the discussions ahead. Thank you.
Thank you very much. We now proceed by giving the floor to Cambodia, to be followed by Belize. Cambodia, over to you.
President of the Special Session of the World Health Assembly, WHO Director General Dr. Tedros, Excellencies, Honorable Delegates, ladies and gentlemen. Cambodia's experience in responding to the pandemic reflects the critical importance of investment in preparedness, particularly in core public health capacity for rapid assessment, detection, and response. Cambodia's remarkable success in COVID-19 vaccination rollout as a result of strong and brilliant leadership of Samdech Akia Mahasana Padej Techo Hun Sen, Prime Minister of the Kingdom of Cambodia, under coordination and management of the Ad Hoc Committee for COVID-19 vaccination throughout the country, proactive engagement, commitment, as well as multilateral, bilateral, and private sector collaboration and community mobilization to build public trust on vaccine. The Royal Government of Cambodia appreciates the intensive work undertaken by the working group on strengthening WHO preparedness and response to health emergencies. Cambodia is grateful for the exchange of views during the Regional Committee for the Western Pacific to learn from country-level experiences of COVID-19 preparedness and response. Cambodia supports the strengthening of the IHR 2005 as the key international legal instrument for global health security, rather than having a potentially duplicated new instrument. We should enhance the existing mechanisms under the IHR framework, especially investing in national core capacities and the global system for public health emergencies, including the consideration of the importance of good governance of the member states and of the WHO as a dynamic, successful force in pandemic preparedness and response. We welcome the deliberations to consider additional mechanisms that will complement the IHR 2005 towards reinvigorating global, regional, and country effort on pandemic preparedness and response. In addition, Cambodia supports the considerations of adequate and sustainable financing, promoting whole of government and whole of society approaches, multilateralism, and concerted efforts against misinformation, disinformation, and fake news. Thank you very much.
Thank you so much, Cambodia. We now invite Belize to please take the floor.
Excellencies, now more than ever, we need the countries of the world to unite. Now more than ever, we have to end the inequality that is too real in the distribution of the COVID-19 vaccines. Ladies and gentlemen, this pandemic has now become the pandemic of the unvaccinated. We must end the double standards and mixed messages. No country is safe until all countries are safe. The race for the vaccines have left the less developed countries at a disadvantage. The cost of treating COVID patients is burdensome on the economies of our countries. This is why we need to be more inclusive of all nations to join in the fight against this pandemic. The COVID-19 pandemic has had an enormous impact on international health, economics, and society, and has significantly hampered global efforts to achieve the United Nations Sustainable Goals. Despite this, Taiwan's participation in this global health organization has been excluded for political reasons, which has damaged global cooperation on pandemic prevention and control. Viruses know no borders. Inclusive collaboration is key to successfully containing the pandemic. As the Independent Panel for Pandemic Preparedness and Response has highlighted, the world was not prepared for the COVID-19 pandemic and must do better. The exclusion of Taiwan from WHO is detrimental to combating the pandemic and building a better post-pandemic future. It is therefore essential that Taiwan be included in the global health system. The COVID-19 pandemic has shown Taiwan is an indispensable part of the global health network. It has demonstrated that Taiwan can play and has played a critical role in the global surveillance and alarm systems against emerging infectious diseases threats. Taiwan's participation would allow it to work with the rest of the world in realizing the fundamental human right to health as stipulated in the WHO Constitution and vision of leaving no one behind enshrined in the SDGs. Belize is mindful of the multi-sectoral approach that is required to combat the COVID-19 pandemic, the biggest threat to health in the last decade. It is in this regard that Belize is committed to the One Health approach. Belize is one of 3 countries that has embraced this approach before the start of the pandemic, and even more so now. The Ministry of Health and Wellness has partnered with the Belize Agricultural Health Authority, a statutory board under the Ministry of Agriculture, Food Security and Enterprise, to process some of the COVID-19 PCR samples. Honorable members, Belize is committed to the work of the World Health Organization and looks to it for guidance in terms of prevention, preparedness, and response to future pandemics and emergencies. I thank you.
Thank you very much, Honorable Minister. I now give the floor to the Central African Republic, please, to be followed by Serbia.
Excellency, the President of the General Assembly, WHO General Director, dear brother and friend, distinguished representative of member states, ladies and gentlemen, the COVID-19 pandemic has exposed and worsened the inequities both within and between countries. The global vaccine target set by the WHO for all countries to fully vaccinate 40% of people by the end of December 2001 is far away to be reached in the Central African Republic. The inequities related to access to essential supplies such as vaccines, personal protective equipment, and diagnosis in developing countries, in particular in Central African Republic, is due to the limited manufacturing capacity in Africa. This has resulted in heavy reliance on the importation of medical countermeasures, which are further impacted by, among others, tariff and time availability. In order to strengthen the emergency preparedness and the response in Central African Republic, in the African region and globally, I urge the international community to consider equity as the guiding principle and the goal in respect to access to medical countermeasures and tools in the context of a global pandemic. Collaborative measures are essential to enhance equitable access, including sharing of technology, know-how, through an established commitment by government to incentivize vaccine manufacturers in both the private and public sectors to share their technology with African counterparts. As the Minister of Health in Central African Republic, I share the view that the International Health Regulation 2005 remains the primary tool for guiding public health emergency preparedness and response, and therefore remains central in managing disease outbreaks at a national level and averting international spread. Based on the COVID-19 experience, member states have applied discriminatory policies in terms of international travel. Therefore, there is a need for a common standard in respect of international travel requirements. In the Central African Republic, there is an insufficient investment by national government development partners international financing institutions, and the private sector into the national preparedness and response capacity for disease outbreaks and other health emergencies. This situation has worsened by the hardship caused by decades of political and social instability due to a protracted security crisis, whereas the country has to respond to multiple outbreaks such as measles, rabies, monkeypox, and COVID-19. Indeed, effective global solidarity is vital for a country such as the Central African Republic, where 63% of population are living in humanitarian crisis. Every effort should be made to align and support the already existing health emergencies, financing structures, including those under the auspices of the WHO, and ensure that resources are channeled to structures with solidarity and equity as the guiding principles. Economy and political power should unite, not divide. The people and the government of the Central African Republic congratulate WHO and the member state for having adopted the UHPR at the 73rd World Assembly. The CAR is also honored to be the first pilot country in implementing this instrument. On behalf of the Central African Republic government, led by Mr. Henri Marie Dondra, Prime Minister, and the enlightened leadership of Professor Faustin Archange Touadéra, President of the Republic, Head of State, I thank the World Health Assembly for the constant technical and financial support in all areas of health, particularly in preparedness and response to public health emergencies. Thank you.
Thank you, Honorable Minister. Now, Serbia, the floor is yours.
Ladies and gentlemen, I would like to start by highlighting the absolute commitment of Republic of Serbia to WHO efforts to greater solidarity during this hard time. A legal document that WHO is drafting will improve our response to pandemic we are facing now and increase our preparedness to future health threats. Protecting our citizens from the virus and supporting the global efforts to contain its spread have been our main priorities. We have provided our healthcare professionals and institutions with personal protective equipment, ventilators, and oxygen needed for patients with the most severe condition. Republic of Serbia built and fully equipped 3 new COVID hospitals worth 260 million euros. They were built to make healthcare accessible to the whole population. These hospitals have more than 2,000 beds and more than 1,000 new employees, doctors and nurses. We all know that prevention is the best way to fight all diseases. Republic of Serbia paid 2 million euros for development of vaccines and more than 5 as contribution to the COVAX system, which we are members since 2020. We were among the first to purchase vaccines for all manufacturers, so our citizens have the opportunity to choose between 5. Serbia also donated some amount of vaccines to undeveloped countries of Asia and Africa, but has not forgot the region Niger. We enabled vaccination of people from neighboring countries who did not have vaccines at that time. Republic of Serbia has been also purchasing medicines for treatment of COVID patients recognized by EMA. Our government has made a decision on multiple financial aid to all citizens, but also to companies to overcome the difficulties caused by the pandemic. Our President, Aleksandar Vučić, was the representative of one of 25 countries who were the first to support initiative of the President of the European Council to work on a new pandemic treaty. This support has shown our dedication to this document, which will ensure exchange of information and coordination of measures in real time between all European countries, ensuring that everyone is prepared to contain the spread of the virus. The document to be drafted, recommended by the Working Group on Strengthening WHO Preparedness and Response to Health Emergencies, will show true political will to act collectively against global challenges posed by pandemics and beyond. The Republic of Serbia will actively participate in this process, which will strengthen adherence to public health measures and minimize the impact of social and economic disruptions on national health outcomes. The One Health approach advocated by the WHO would bring a new preventive dimension in confronting pandemics not covered by the existing international system. Thank you.
I thank the Republic of Serbia and now give the floor to Oman, to be followed by Barbados.
Your Excellency, dear Chair, Excellencies, dear colleagues, this special session of the World Health Assembly is a testament to our commitment as an international community to enhance global health governance. I would like to start by commending the Working Group on Preparedness and Response for its dedication and diligence not only in analyzing the status quo and addressing the possible options to move forward, but also in keeping the member states informed and involved throughout the process. We took note of the WGPR's report and we found its recommendation comprehensive and clear, and we agree with its provisions. While the international health regulations do require enhancement and review, a new international instrument under Article 19 of the WHO Constitution would complement international efforts towards more effective pandemic governance. Throughout this crisis, the WHO has demonstrated great leadership, and its position allowed countries to share best practices and lessons learned. An international convention or treaty would strengthen the WHO role to fit the needs of today's globalized world. This new instrument must operate under the auspices of the WHO with a view towards consolidating fragmented efforts and streamlining international health governance. The process of establishing a new instrument and amending the IHR must address the need for better monitoring and compliance mechanism and must place considerable emphasis on prevention. It should also dedicate pooled resources for strengthening national public health system in line with universal health coverage and bridging gaps between the international governance of health and other sectors which have proven to be ever more intertwined and interdependent. Colleagues, we should not allow history to repeat itself when we can do something about it now. Regardless of our differing view on the way forward, I am confident that we will find a common ground. Alongside whatever process we agree to move forward with, we should work within our countries to shift our health governance models into more cross-sectoral and comprehensive ones. We endorse the WGPR's recommendations. Thank you very much.
Thank you, Oman. I now invite Barbados to please take the floor, to be followed by Yemen. Thank you.
Madam Vice President, Director General, Excellencies, distinguished colleagues. Barbados appreciates the opportunity to add its voice at this World Health Assembly special session on such a critical and important topic. I address you at a time of great uncertainty. However, these circumstances also present us with opportunities to reflect. A key message coming from this special session is that we can have hope as we strive for clarity of thought, unity of direction, and strength of purpose. Barbados, like many small island developing states in the region, has not been spared from the COVID pandemic. Indeed, the region of the Americas leads the world in incident cases. Collectively, the countries of the Americas carry the largest burden of the COVID pandemic globally. No country has been spared. We feel the loss of thousands of lives and the suffering of millions more due to illness and sickness. We are experiencing the negative impact on individuals and livelihoods through declining economic growth and investment, as well as rising unemployment and social dislocation. However, Barbados chooses to concentrate on the opportunities for sharing knowledge and experiences, using the principles of public health to inform economic decision-making. We are committed to opening our borders to commercial and other traffic in an orderly and purposeful manner, and protecting our population using safe and efficacious medicines, vaccines, and technologies. We are well within the second year of the COVID pandemic. We continue to be challenged by concurrent emerging and circulating variants, vaccine inequities, and vaccine hesitancy. These factors threaten to further debilitate the region's already stretched and underfunded health systems and public health infrastructure, all at a high societal cost. Barbados proposes global leadership and economic investment as a means of reversing the tide of inequity and social disruption. This requires collaboration in a spirit of solidarity and equity to ensure an effective global response to COVID. All countries can only be safe if individual countries are also protected. Global leadership involves making difficult decisions, such as delaying boosters while other countries have no access to vaccines, the sharing of human resources and expertise, and creating a pool of knowledge to support decision-making to minimize the loss of life and the maintenance of productivity. Barbados, therefore, fully supports the adoption of an international treaty that will ultimately realize preparedness for future pandemics, international cooperation, and solidarity in these uncertain times. Thank you, Madam Vice President.
Thank you very much, Barbados. I understand that we're deferring slightly at the statement from Yemen, and with that I have the pleasure to give the floor to Qatar.
Thank you. We in Qatar support the statement by Iraq on behalf of the Emirates countries that has been delivered yesterday. Also, the COVID-19 pandemic has disclosed the need for a stronger international collaboration headed by the WHO in epidemic prevention and control. As the current tools and instruments, although useful, have limitations, as we know and discussed. The identification of the problem and impacts was quite late, and we need more efficient scientific early warning systems to predict potential threats. Also, the One Health approach implementation has been mentioned repeatedly throughout the crisis and even before the crisis, but in reality was less than the required and needs empowerment. Information on early suspected cases and potential epidemic threats needs to be shared promptly and without hesitation, and to be properly done in a fair and methodological international evaluation should be also made possible. This should be transparent and carried out in a collaborative fashion, overcoming national concerns which may delay global response and control. The WHO should be in a position to play its role in a fully independent way with the necessary legal and sustainable financial and human resources. We need all to support that. Ladies and gentlemen, the pandemic showed how much we miss and what can be done and what should be done. The tremendous human and social and economical impact of the COVID-19 pandemic is unprecedented, and no country would respond efficiently to a similar crisis in the near future unless we work together. With all of this in mind, Qatar fully supports the establishment of an intergovernmental negotiating body in charge of developing a WHO convention or agreement or even international instruments on the pandemic preparedness and response. Thank you.
Thank you very much. And now we invite Togo to please take the floor, to be followed by Nicaragua. Togo, the floor is yours. Togo, are you able to hear us, please?
Oui, on vous entend.
Yes, we can hear you. Thank you very much. Right, thank you. Mr. President, Director General of WHO, ladies and gentlemen, Togo supports the conclusions of the working group of member states on the strengthening of preparedness and response of WHO to health emergencies. it is absolutely clear that the COVID-19 pandemic has highlighted the gaps in the preparedness and response to the pandemic and the difficulties of ensuring equal access to health. Health systems have been put to trial by fire, and the IHR 2005 have shown the constraints in the application. In that respect, we congratulate the working group for the high quality of their report, and particularly for the topics raised in that report, namely the crucial importance of equity, the priority of the One Health approach, and as well as the compliance with the commitments under the RHI, taking responsibility and discussing the issue of financing. TOGA supports the taking coordinated measures at national and global level in order to strengthen the preparedness and response. Through the development of a new agreement or another international instrument of WHO. In fact, it is absolutely crucial that that would be a mechanism promoted at the highest possible political level, and an approach that would take on board all of the stakeholders, all of the social groups, with the possibility of upgrading and strengthening the primary role played by the WHO in coordinating actions of other countries. It's both a governing and coordinating role. TOGA supports the statement of Botswana on behalf of the African region of WHO, which has opted for the development of a new instrument to strengthen the preparedness and response to pandemics, while stressing the crucial and growing importance of WHO in the World Health architecture. I thank you. We thank you too.
The United Arab Emirates, please, to take the floor.
Thank you, Chairperson. I'd like first to thank and appreciate Dr. Tedros and his team for the tremendous efforts in combating COVID-19 pandemics. United Arab Emirates support the proposed instrument, and we expect to contribute to strengthening the various health systems of countries, which can lead to promote preparedness, response, and resilience. The proposal should reflect the shared political and financial commitment of countries to ensure health equity as a global goal to address various health challenges. And it is necessary to consider the different capabilities of countries and the effective contribution of countries in enhancing their capacity building to access justice and integration. This instrument should support the International Health Regulations 2005, and the mechanism should develop to link the various initiatives and tools available in order to unify efforts and avoid wasting resources and repetition towards strengthening preparedness and response to health emergencies. Finally, including the concept of One Health in the new instrument by giving the necessary priority to the animal health sector through involving the relevant technical bodies is fundamental. Thank you very much.
Thank you very much. I now invite Nicaragua to please take the floor.
Buenos días a todos.
Good afternoon to you all. Mr. President, Your Excellencies, ladies and gentlemen, I welcome you on behalf of the people of Nicaragua and our reconciliation government. The COVID-19 pandemic has had a devastating impact on the lives of Nicaraguans and on the economic development of the country. The Nicaraguan government, led by Daniel Ortega, has put in place measures to alleviate the impact and vaccinate the population in order to tackle this pandemic in maintaining basic health care. While maintaining basic health care, efforts to combat the pandemic should be inclusive and non-discriminatory. We thank the countries that have displayed solidarity and have donated vaccines and PPE to Nicaragua. And that has helped us to have 63% coverage over the first dose and 46% by the second dose, with regard to the proposal to develop an international instrument for the preparedness and response to pandemics or health emergencies has Nicaragua's support. What we need to do is to strengthen the governance of the instrument. And finally, we see it as, urgent to answer the question of financing needed to strengthen capacity and achieve universal health coverage. For that, we need participation, commitment, and commitment of all. Thank you very much.
Yeah, to please take the floor. Bolivia, we are able to hear you.
Bolivia.
Yes, please proceed. The floor is yours.
Mira, Bolivia.
And we're looking forward to hearing from you, Bolivia. The floor is yours.
No, Maria Morales.
It appears that we have challenges with the sound. We shall come back to you at the earliest time possible. And now I understand that you, Madam Vice President, would like to take the floor for a few moments.
Thank you, Secretariat. We have now come to the end of the statements by delegations, and we'll move on to hear the statements by observers, followed by the United Nations and other intergovernmental organizations in effective relations, and finally, non-state actors in official relations. However, I have been informed that the interpreters have kindly agreed to stay with us until 6 p.m. in order to allow us to complete all the statements today. Are there any objections to proceeding in this way? I see none. Thank you very much for your cooperation. I will now hand back the floor to the Secretariat to moderate the session.
Thank you very much, Madam Vice President. With your permission, I would like to give it a try once more with the plurinational state of Bolivia, in case they're able to connect.
Yes, please proceed.
Thank you so much. Plurinational state of Bolivia, the floor is yours once again.
Sí, tenemos la descarga, ¿no? El anfitrión le ha activado el micrófono.
Okay, it appears that we're having and come back to you later. Now I invite the Holy See, please, to take the floor, to be followed by Palestine.
Thank you, Madam Chair, Madam Vice President, Director General. The decision of the 74th World Health Assembly to hold a special session on pandemic preparedness and response is a clear sign of the recognition by member states that global health emergencies cannot be addressed in a piecemeal fashion, but rather must encompass a coordinated response that involves the local, national, regional, and global levels. As members of one human family, the whole of society has the duty to respect the dignity of each and every person. In the context of the ongoing pandemic, this implies not only the responsibility of governments to adopt the necessary measures in conformity with the most reliable scientific data, but it also demands that each and every member of society act responsibly in order to protect one's health and that of others. Along these lines, Pope Francis has affirmed that receiving medically approved vaccinations is a concrete act of love towards our neighbor that contributes directly to the common good. The COVID-19 pandemic has clearly demonstrated how access to universal basic health care is a condition sine qua non for the integral development of all human persons. It has also provided evidence of the collective moral imperative for the international community to commit itself even further to ensure the provision and sharing of adequate resources, information, and technologies so as to achieve health for all, especially in places where distribution of countermeasures, including improved vaccines, therapeutics, and diagnostics, have remained scarce, inequitable, and untimely, and where health systems are still weak. The decisions that will be taken at this special session of the World Health Assembly will have a decisive impact on how the international community responds to such urgent challenges. The Holy See considers that there would be a benefit to developing a new international instrument to complement the strengthening of existing instruments and mechanisms, only inasmuch as it has a strong focus on solidarity and support capacities, especially towards low and middle income countries. In this context, it seems appropriate to recall Pope Francis's inspiring words, "I am thinking of what comes after, of the future and of the social and economic consequences. The future has a memory. I ask you to prepare the future with science and imagination to rise above the challenge in front of us." Thank you, Madam Chair.
Thank you very much. And now I give the floor to Palestine, please.
شكرا سيدة نائبة الرئيس، معالي الوزراء، أصحاب السعادة، سيد المدير العام لمنظمة الصحة العالمية، سيدات وسادة.
Director General of WHO, ladies and gentlemen.
في جميع مناطق العالم والوصول إلى اللقاح عبر الكوفاكس وتقرير التأهب والاستجابة للطوارئ. فلسطين تتمنى نجاح هذه الجلسة الخاصة.
Apologies for the interruption, distinguished delegate. We're having an issue with the interpretation. Would appreciate your patience for a moment.
I think next time we have to prepare our statements in English or in other language other than Arabic.
Apologies. We're in a brand new room and we're all trying to do our very best. I very much appreciate your understanding and patience. As soon as I receive thumbs up from my colleagues, we can proceed.
Yes, you can. There's a small technical issue. If the gentleman prefers to speak in Arab, I think that has been solved and he could proceed in his mother tongue if he prefers.
I prefer my mother tongue, please.
Please proceed, distinguished delegate, and apologies again for the interruption.
شكرا سيدة نائبة.
Thank you, Madam Vice Chair. Your Excellencies, Director General of the WHO, welcome to you all. I'd like to extend my gratitude to WHO and the Working Group of Member States for an excellent report on the preparedness and response to health emergencies. We hope that this second special session of the World Health Assembly will be crowned with success. Madam Vice President, contagious diseases don't have passports, they don't know borders, and there are no commercial guarantees. It would seem to me that health is much more important than any other of our actions. In fact, a majority of the inhabitants of our planet are still awaiting the arrival of vaccines as well as other countermeasures. That is still a hot topic for debate all around the world. You can see once again a very wide gap between the rich and the poor.